In this video, I will tell you what psychologists should know about ME/CFS. ME is short for myalgic encephalomyelitis and CFS of chronic fatigue syndrome. I have got ME, had it since 2018, and I'm also a psychologist. At the moment I cannot work, but I thought it would be useful for psychologists to know what the illness is and how to help people with ME. I don't think many psychologists are very familiar with the illness. It is underdiagnosed and not very well known by the doctors either. It is some sort of a energy deficiency illness. So the body cannot produce enough energy for the person to function in a normal way in their daily lives. And that can cause all kinds of symptoms like tiredness and muscle weakness, aches and pains, stomach issues, brain fog, you name it. The hallmark symptom of ME/CFS is post-exertional malaise, short PEM. That means that if a person exceeds their energy limits, they have got only this much energy compared to healthy person's energy, and if they go over that limit, they will crash. That's the post-exertional malaise, and that crash comes with the delay only after day or two, and that crash means that all the symptoms get worse, even much worse. You won't really meet people with ME at your office, the ones who are really ill. You will only probably meet the ones who are moderately or mildly ill, because the ones that are really severely ill cannot leave their house or their bed. There is a history with ME/CFS that it was a long time ago. It was thought that it was psychosomatic, and the muscle weakness was caused by deconditioning. But nowadays the science has proved that wrong. It is a physical illness, and there is some sort of treatments and medication that can be tried for people with ME, but they won't help everybody. But because of this history, it was thought that gradually adding on exercise, so-called graded exercise therapy, would help them, but it doesn't. It actually makes many people with ME much worse, because it means that they are exceeding their energy limits again and again, and that makes the illness much worse. There's also thought that offering cognitive behavioral therapy would help them. That's also not worked out very well, because some people also find it harmful. That's because if you offer this cognitive behavioral therapy in a way that you think that it would make them healthy, point of the therapy is often that you shouldn't think that you are ill, you should think that you are healthy, and that way you'll be somehow cured. The advice not to exceed the energy limits, and again they'll crash and they get worse. You can offer cognitive behavioral therapy in order to help your customers to get adjusted with chronic and difficult illness. That's what you can do. It can be sometimes difficult to differentiate between ME and depression because of the tiredness and so on. And for example, Beck's depression inventory is not very good at making a difference between those two, because it has got questions like sleep, and people with ME don't sleep usually very well, or they sleep much more than they usually do. And they might lose weight or overeat, and they may not have the energy to do the things they were used to be able to do, and so on. But that's because of the illness, it's not because of the mood. But of course many people with ME have got depression as well, because they have lots of things. Many people lose their jobs, their income, ability to study, friends, ability to go out independently, and so on. You can ask a question from both depressed and people with ME that if you could do anything you want, if you weren't tired and if you were healthy, what would you like to do the most? So depressed people would probably have difficulty saying what they would enjoy, and they haven't got the sort of perspective to this kind of things. They can't find the joy anywhere really. But people with ME would say they have, different things. They would have lots of things they would like to do, like cook a meal for their family, or go for a walk in a park, or go traveling, or go back to their hobbies and exercising and so on. So this is something that you can do to try and differentiate between those two. It's different to know if the customer has got ME or depression, because they have different sort of treatments. For example, many depression medication is not really safe for people with ME. It can make them worse. And also you might offer advice for the depressed person that if they could go for a walk, for example, in the nature and so on, go outside, get some exercise and fresh air, and that same advice would probably make a customer with ME even worse. First, if you are starting to work with a customer who has got ME, if it's therapy or counseling or anything like that, you have to discuss with your customer if they are fit enough to have the therapy. Many of people with ME just can't do it because it exceeds their energy limits. Even thinking, cognitive functions can do that. They can have post-exertional malaise from, for example, from going to the shop or taking the rubbish out or meeting a friend or having a phone call or reading a book, for example. So first you have to discuss if the person is okay coming to your office, for example, if you're meeting face-to-face, or if it's too much. And if they get post-exertional malaise from that, if they crash, you could discuss if you can have distant meetings. And if 45-minute distant meeting is too much, maybe it could be 20 minutes or 30 minutes or something like that. You can help your customers with ME by offering advice and discussion on how to adjust with the life crisis, because of course it's a huge crisis to get a chronic illness and to realize you're not actually getting better. Of course some customers will get better, but it's not very common, especially if you have been ill for 2 or 3 years already. I'm sure you know how to help person to adjust in a life crisis, because that's your job. So I won't talk about that more. But it's good for you to understand that pacing is very important for customers with ME. If they have got, for example, very good physiotherapists, they have got advice already about pacing. So that means that the person won't do too much. They are trying to avoid this post-exertional malaise and adjusting their daily activities so that they wouldn't crash. This is very important in treating of ME. It's actually, I think, the most important thing. But it can be frustrating at times, because when customers with ME, when they have a good day, they want to do things they haven't been able to do before. They have been lying in bed, for example, for days or weeks because of post-exertional malaise. And then they want to tidy up, they want to cook some food, they want to meet their friends because they have to cancel meetings and so on. And then they do it, and then they crash again. And then they just have to learn how to live with this kind of knowing all the time that they can't do as much as they want to and as much as they feel they could do at the moment. So motivating with that and having a discussion about how to do this daily limiting of activities can be fruitful. Also encouraging to try a little bit of exercise if they are in a good shape, but not pushing, because some patients can get a little bit better if they are in a good shape and they start adding really carefully activities, but it doesn't work for everybody. If you are into relaxation techniques, do try them or ask your customer if they want to do relaxation techniques like mindfulness or meditation or very relaxing yoga, because they are good mentally. And some patients with ME actually say they feel a little bit worse. Their symptoms are not quite as bad if they have this kind of relaxation techniques. That's because one thing that ME does is that it causes dysautonomia. So the patients usually have high resting heartbeat and low heart rate variability and so on. So their body is kind of in stress state all the time. So some people find that this kind of relaxation techniques help with their symptoms. I personally, I haven't found that they help with my symptoms, but they help me mentally. I will add lots of resources and links for you in the description that you can go through on your own or with your customer if you want to. And if you have anything to ask about ME, just write in the comments and I'll try and answer, or maybe I'll make another video about subject you are interested in. Thanks. Bye bye.